Good afternoon, ladies and gentlemen. I want to thank you all for your time and your opportunity to make this presentation from a wholesaler's perspective. My name is Daisy Issa. I'm the head of marketing and strategy, Chan Medifarm Nigeria Limited. We will be highlighting the following key issues during this presentation: availability of quality assured medicines and their origin, the constraints in supply chain, the demand for locally manufactured products vis-a-vis imported ones, and of course, Chan Medifarm's experience as it relates to local manufacture using contract manufacture using local manufacturers. Now, first of all, let's give a perspective to who a wholesaler is. For us, a wholesaler is an important intermediary in the supply chain that exists to sort out discrepancies of product quantities, place, and possession. Now, in putting that into perspective, we understand that patients do not get the product as at the time they need it. I mean, manufacturers do not manufacture the products when a patient needs it. Those products have to be pre-manufactured and taken to a point where patients can access it at the point of need. Now, the critical link in achieving that is the wholesaler who buys this in bulk from the manufacturer and places it at strategic places. So it's very important for access to medicine to succeed that wholesalers are carried along. And this perspective is what we'll be looking at. Now, what are the factors that influence wholesalers when it comes to procurement of medicines? We are taking a look at a country like Nigeria, Tanzania, and Cambodia, and you will find that the factors vary from country to country. If you look at Nigeria and Tanzania, cost is a very important issue when it comes to procurement of medicines. Then, of course, credit terms that the manufacturers are going to avail to the wholesaler is also very important. Quality cuts across all three countries: the quality of the product and the credibility of the product. The reliability of the manufacturer in making sure that these products are available to the wholesaler when he or she needs it is also an influencing point. Of course, regulatory authorities, the registration status of that product in the country is also important for a country like Nigeria and also Cambodia. And customers' demand also drive the kind of product wholesalers carry. High profits is not really an issue for Nigeria and Tanzania, but it's a consideration for Cambodia, and you have it as it's listed that. So from the wholesaler's perspective, all those things determine the kind of products they carry in their kitty. Now, what are quality assured medicines? Because as we go along the line, different people define quality different ways. But for this presentation, I'll be defining quality as a medicine, a quality assured medicine, as a medicine that is either registered or authorized unregistered medicines that meets documented pharmacopoeia specification and manufactured using prescribed national or international GMP guidelines. And such a medicine should be stored and distributed in a manner that ensures safety and efficacy is guaranteed. So that for us is what a quality assured medicine should be. Now, how available are these medicines from a wholesaler's perspective? Now, if we want to talk about physical availability, we have to put it into context also, that we are defining availability as the relationship between the type and quantity of product and service needed and the type and quantity of product available. So we have to put that into perspective to appreciate what availability is all about. So if you need HIV medicines and you need them in thousands and they are not available at the time you need them, then there are availability issues. Let's look at the global picture of availability based on WHO World Medicine situation. What's happening is that availability is generally an issue. Private sector availability of generic medicine is higher than in public sector in many of the WHO regions, and that is really a cause for concern. And this is even more pronounced in countries like Africa, Southeast Asia, and Western Pacific, where you have the availability of medicine not up to 60%. And of course, by this we mean essential medicines. Now, looking at Nigeria, for instance, availability of generic medicines are more than branded medicines, and this assessment was done also by WHO in partnership with Health International, HAI. In Uganda, you have the same issue. So why are there discrepancies between public sector availability and private sector availability? That is a question we have to look at as policymakers, as health implementers. But from a wholesaler's perspective, the fact that the the private sector is able to have access to medicine means that wholesalers actually have access to these medicines, because when you put into perspective that a lot of private sector people patronize the wholesalers, and if the indicators at the wholesaler level is good, it's actually an indicator that the wholesalers are carrying what they feel they need. Now, what are these sources of medicine in most African countries? I try to put a little perspective here by comparing some African countries and the sources of medicine. What we have there is, as you can see, is that a lot of African countries, Nigeria inclusive, are still dependent on imported medicine source. For a country like Nigeria with over 125 local manufacturers, you would think that that is sufficient to take care of our local needs, but it's just taking care of only 25% of the population's need. And when you put it into perspective, we are also talking about a lot of these products being OTCs, products for non-communicable diseases that is fast becoming an issue, needs to be imported. So we really have an issue in terms of the kind of products that are manufactured locally. The scope is quite very narrow. But this is what we have. A lot of companies, a lot of countries are still dependent on imported products. And of course, the importation is usually from India and China. Now, looking at Nigeria specifically, these are some of the products by therapeutic group that are manufactured locally. This is the percentage that comes from the local manufacturers, and the other ones are the percentage that come from imported companies. So you still see that despite what is happening, if you take something like anti-TB, or let's say antihypertensive, like I was trying to highlight, you find out that the local manufacturers are just giving 14%, while 86% need to come out. So this, the cocktail of products being manufactured locally actually needs to be looked at. Now, from the supply chain perspective, what are the issues that wholesalers look at? We need to understand that the supply chain is the point where products move from the manufacturer and finally to the end user. And what we see in Africa is that you have a lot of forward and backward integration, where a wholesaler is a retailer, sometimes a manufacturer is a retailer, sometimes importers are also retailers, and you have all those kind of forward and backward integration. But what is very, very clear is that the supply chain of many developing countries, and especially in Africa, is very, very chaotic. If you have to, for instance, do a medicine or product recall in Nigeria, I tell you that it will almost be impossible, because wholesalers are not looking at the batches that come to them. We are not even looking at where these batches are going to. We really are not looking at that. So it's a huge challenge. And these constraints in supply chain inefficiencies combine to cause shortages in products, growth of the informal sector. Now, the informal sector is a sector that takes care of the ordinary man in a more, like the informal sector, where you have a lot of illicit and substandard products being sold to customers there, because those products there are found to be cheap, even though they don't have the quality. Now, storage and wastage, stock out and wastages are also an issue as a result of supply chain inefficiency, product deterioration, inaccessibility, and of course, all this translates into poor health outcome. Now, what are the various reasons given by manufacturers regarding these constraints? Some of them are regulatory in nature. some of them are raw material issues, some of them are manufacturing issues. But the compelling fact is that for the wholesaler, these are not important to him or her. What is important to us is we need the right product at the right time, in the right place, and in the right quantity. But when you look at regulatory issues, for instance, there are a lot of things that could make up regulatory issues. Financial institutions also would contribute to issues, because depending on what is happening in the country, you may not be able to access a particular amount of USD that you need, and all those things actually pose a constraint on manufacturing. Now, distribution. You find that a lot of the global players or WHO and all those regulators are actually giving a lot of focus to pre-qualification, GMP implication and application and all those things. But when you look at good manufacturing practice, there is also the good storage practice and the good distribution practices, which many countries are not implementing, especially in Africa. And we believe as wholesalers that many of the issues we have when it comes to products failing are a result of non-regulation of these aspects that is very critical, that is the distribution. You have an issue where a product that needs cold chain storage, for instance, is brought into the country in the proper manner by the wholesaler, by the manufacturer. But at the point of distribution, it's either distributed using a vehicle, for instance, that is not doesn't have a cold chain capacity, or at the point of dispensing, it is dropped in just the shelf instead of putting it in a warehouse or in a cold chain. So all these things add to the challenges we have, and we believe that part of the reasons why these are happening is because we have few numbers of reliable haulage firms that are pharmaceutically, will I say, tailored. Product consideration also are not taken into cognizance when they are being distributed. Poor transport infrastructure, you don't have a lot of air connections between points, so you have to rely, and of course social instability, you are not able to get your product across. So these are the challenges, distribution challenges that actually limit access to medicine from a wholesaler perspective. Now, storage is also an issue. A lot of manufacturers don't have huge warehouse spaces, and even the storage condition in these warehouse spaces do not meet international specification. Like if you look at Africa, where your warehouse must be zone 3 and zone 4 compliant, a lot of our warehouses don't meet that, and that means a lot of deterioration takes place. That also leads into shortage of product availability, and you have that. So to mitigate these challenges, what wholesalers try to do is to buy up a lot of stock, and when you put it into perspective that they don't have consumption pattern, and of course their cash flow is quite poor, they end up tying down the limited capitals they have, and they are not able to pay manufacturers, who in turn are not able to make the kind of purchases they need to. So it has a backlash on the supply chain. And of course, wholesalers are now investing in warehousing to allow for more volume purchases from manufacturers. Of course, manufacturers can do well to improve storage condition and distribution condition. How available? Okay, thank you. So let me just quickly summarize that locally manufactured products are in high demand in Nigeria, for instance, and a lot of our companies there are local manufacturers, and our turnover is quite high. And of course, what are the opportunities? The opportunities are enormous. We believe that despite the challenges they are having, if we have these local products being made, it will give us a good chance. And of course, from Chan Medifarm's experience in contract manufacturing, we would rather work with international manufacturers than local manufacturers because of a lot of issues as highlighted there. Thank you very much.